and welcome back to the Advancing Health Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, really excited to have you here because you know why? We're bringing some pretty incredible conversations with some fierce leaders that are painstakingly just changing the way healthcare is delivered. And we're really passionate about innovation, adoption, leadership, and access. And if it's your first time tuning in, let me just sort of just take a quick step back to tell you a little bit more about what we're trying to do here. So we're focused on bringing stories of innovation within healthcare to life. And the aim is really about talking to real people that are in the trenches, doing the work, getting stuff done, to have them give share of what they're working on, things that are working, maybe even some challenges, and just kind of give them the space to be real for a minute. And if you haven't checked out any of our other historical interviews, make sure that you hit the subscribe button now so that any new ones that come to you go right to your inbox. So we've got a really amazing action-packed year with just some incredible content, amazing leaders that are coming on. So can't wait for you to hear about them. So our field is vastly evolving quickly, and it's crucial to have leaders who really envision the future, that can demonstrate deep compassion for the underserved and eagerly embrace innovation to address, a lot of these pressing challenges. And our next guest on the show is one of these leaders. Jonathan Kumar embodies the very essence of genuine innovation and within healthcare and social support, setting a benchmark for social progress and empathy. And Jonathan is the founder of Samaritan, an innovative platform that bridges the gap between technology and compassion, offering a beacon of hope for those on or near the street. And Jonathan, his background's amazing. He'll share more about it, but he grew up knowing what hard times look like, with immigrant parents. He and I share this in common, both coming from immigrant parents, and who taught him the importance of looking out for one another. And Jonathan's early life was steeped in the value of community and the profound impact of what kindness looks like. So before Samaritan, Jonathan shared his passion for social change through a documentary called Talum. And by starting food circles, in essence, a smart way to help feed people in need while saving food from being thrown away. And however, it was really sort of Samaritan that Jonathan has truly revolutionized the way we assist those without homes. And Jonathan's idea for Samaritan uses special wallets that help people without homes set goals and get the funds they need from people who believe in them. And this isn't just about money, it's about connecting people and helping build a community that cares. So Jonathan's resilience is unwavering. Faith is strong. It's really helped him kind of propel this mission, this vision forward. And we're super lucky to have him today to share more about, the mission, the journey, and some of the incredible work that he and his team at Samaritan are doing. So Jonathan, welcome to the show. It's great to see you. How you doing?
Man, I'm honored. I feel honored. What an amazing and excellent introduction. I really appreciate the way you put those words, and yeah, thanks, Michael.
Yeah, of course. It's my pleasure. I know we share a lot in common. Our parents are immigrants, so maybe take us a little bit back, share a little bit of your story and tell us who you
Sure.
are.
Yeah, of course. You talk about healthcare leaders envisioning a better future, and the future that my small team has been really focused on is, yeah, a world where anyone on or near the street has access to the financial capital and also the social capital needed to reach their housing, income, and health goals as a result. And the reason we have sort of tied our time to that vision largely comes from my immigrant background, where my family, as new immigrants to the States from South India in the late 80s, was provided that access to financial and social capital. We had moved, or my parents had moved to Buffalo, New York in 1989, and my dad was a student, my mom wasn't working, so the three of us were living on a student stipend of about $600 to $800 a month. And that went further back then than it would now, certainly. But we were very much, on the margins, on the fringe. Our car was worth less than $1,000. We were in public housing, all of that stuff. And what really helped my family make it through those first 5 or 6 pretty lean years was there was a group, a local nonprofit, a church actually, whose congregants were investing into immigrant families, and they came to know my parents and brought them into their community, and yeah, just invested in my parents, and by extension myself, financially, relationally,
Yeah.
provided legal support, actually cultural support, for about 5 or 6 years until my dad graduated and got his first job in the Midwest. And so, my life was more or less on easy street from there, but you never really forget what that's like. And again, that provision of financial and social support is what we hope to provide, and have been providing to folks living on or near the street for a couple of years now, and we are starting to see some just amazing outcomes from a health standpoint, for these individuals who are receiving this like direct financial and social support through
Mhm.
Samaritan. So yeah.
So when you think about that experience and you fast forward it into today, this is it's a pervasive issue. How
Mhm.
how do you just how do you start? How do you even try to wrap your arms around this? And I know you guys have been at this for some time, but just
Mhm.
take us through that moment when you're like, hey, this is what I'm meant to do here, and I'm gonna get after it.
Yeah, yeah. Well, I certainly could take hours to share kind of
Yeah.
the first mechanics of getting something like Samaritan started, and the first people we were able to help. But big picture, more than 1 million Americans don't have a safe place to sleep at night. They go to bed in one place tonight, not knowing if they'll sleep in the same place tomorrow, and that number is growing. um when you're not sleeping well, you're not making great decisions, and when you're not sure about where you're going to eat, where you're going to sleep, the people you're going to encounter, um it it takes a toll on mental health. We're talking about exposure to situations of abuse, violence, the elements, substances. And so naturally, these individuals are landing in the hospital, in the emergency room, on an increasing basis with chronic symptoms that really can't be solved by a hospital, but it doesn't stop people from going in.
Hmm.
um the you read It's funny, you read the Google reviews of any emergency room or hospital in a major US city, and you're going to see a lot of the same things coming from patients, other patients. And there's a significant and continual operational burden that people facing significant poverty, put on our health systems, and not only operational but also financial. And that's where Samaritan has really started to find traction. Our solution helps people access financial and social support to reach, like I said, housing and income goals. Um, and you would think that our primary like funder or customer would be cities or counties, maybe, um like city of Chicago or city of Seattle, city of New York.
Yeah.
But we found that because all roads lead to the hospital for this
Yes.
population, it is the hospitals and the entities paying the person's hospital bills, manage Medicaid plans that have proven to be a more sustainable, scalable, repeatable partner or customer to use Samaritan than
Interesting.
city governments.
Mm.
Um, and so we became a healthcare company as of 2020, 2021. And my background isn't in healthcare; it's in design. Um, but yeah, we have been working in this space to scale up access to Samaritan for people on or near the street who, like I said, are ending up in the hospital on a consistent basis because of what they're dealing with outside of the hospital.
So walk me through sort of a use case. How does someone get access to Samaritan? You know, give us sort of a typical scenario,
Yeah, for sure. I can actually share, a little bit of the story of our first member, Charles.
please.
Charles was in Seattle and lived in a wheelchair after uncontrolled diabetes impaired the use of his right foot. Um, he was homeless and with a bunch of the accessibility barriers at the different shelters in Seattle, kind of just spent time outside. And so, during this time living outside in a tent, he was disconnected from any sort of primary healthcare services, social services, except for, hospitalizations, ED visits for his leg and other things. And so he was one of the first people that got a Samaritan membership, which comes with kind of this nice wallet, and
Yeah.
it comes with this like fancy card that I kind of showed you, I think, when we were
Yeah.
in
Yeah. 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 I saw we were at the
was it LA?
conference.
Yeah, yeah, LA.
Yeah.
Yeah. So he gets this card and from a street outreach team. And we basically said like, hey, this will help you receive financial and social support from people who want to help. It's free. There's $5 on this thing right now, and you'll get another $5 for making it into this housing navigator's office every week or every month. And so he took the card and started getting $5 a week for checking in with the housing navigator group in Seattle. Um, so that was like the first point, was just like having him start to access care on a more regular basis. And then he started basically developing some action steps. Well, the housing team uses our software to convert Charles's goals into like 7, 14, 28-day action steps related to healthcare, benefits access, housing, meeting basic needs,
Yeah.
etc. And so he's getting these 5, 10, or $20 bonuses now, not just for checking in, but for doing other things to take care of
Right.
himself. And he's able to use that money pretty flexibly to meet, food, clothing, transportation type needs. And so, for like the first, like I would say, you know, 6 visits or 10 visits were pretty transactional. Charles is just checking in saying, hey, I'm here. I'm good. I don't need any of your resources,
Right.
and gets the $5 or whatever. So for the first 4 or so months, Charles is, kind of operating in that way, but he's also enjoying the financial benefits and also the social support, which he's receiving through text messages, phone calls, emails from our donor community, the Samaritans, if you will, who are using our app, our website to learn Charles's story, to walk alongside him. Much like, that church walked alongside my parents back in
Yeah.
the day. Um, and so it's around month 6 where I think the the financial support were helping Charles, but he was also starting to develop a positive relationship with a person at the navigation center,
Hmm.
where he got to know their name, got to sort of believe that they had his best interest in mind. And so 6 months later, when the navigator said like, hey, I know about an accessible apartment that's become available. Your, Section 8 voucher would probably cover it, or most of it, at least. Do you want a tour? Do you want to tour it with me? I'll go with you. And after 3 years of being on the street, like Charles said, okay, said like, let's do a tour. And this guy at the nonprofit toured Charles and enabled him to move in. And yeah, I saw him a couple months later, and he had lost a ton of weight. He had a prosthetic. He was even walking out of his wheelchair a little bit. He was accessing physical therapy. He got on the news. Like, it was so cool. And it's just like he it's not like all we did was we provided like $300-400 over the course of 6 months in terms of incentives and some upfront financial support, a bunch of text messages, and this person was able to get take these action steps, which led to a life-changing outcome over time. And it's improved his quality of life, his life expectancy,
Right.
is his hospital visits have gone down significantly. So yeah, we're obviously thrilled about that, and have just seen that happen a ton more times in the work since, in a handful of cities now.
Well, it's something to be said about there's a healthy tension there of like a pull. You're not like pushing them, you're really encouraging them to take those steps. You're not taking those steps for them, you're actually encouraging them to take those steps. So that's
Mm-hmm.
very interesting to see that, they're the ones that are doing the work. You're merely facilitating this.
Yeah.
How much of your background in design, and I'll just call it, behavioral economics, in a sense of sort of the carrot and the stick, how much do you guys have to really think through that to really test? And what are some of those experiments look like when you're having to create something? How much data do you need to compile before you say, hey, we think this can work at scale versus just, individually?
That's a good question. I mean, yeah, I mean, since the beginning, we have been just giving people small amounts of capital. And so we're reinforcing the action steps by giving them bonuses at the end
Yeah,
of that step. But we're also, a lot of the times, our members, homelessness is not just a behavioral issue, it's a poverty issue, and a circumstance. And so we're also giving people capital up front to like, if they need to get to an appointment as an action step, they may not be able to get there because they don't have bus fare, or they don't have footwear even to
yeah.
walk, or they need a cell phone for a job to call them back before they can really apply. So we, cover some of these needs up front as well through our Good Samaritans, who again, can sign up on you can download the Samaritan app on Android or iPhone, or go to our website and contribute to members in a specific city. And so yeah, I mean, we have looked into the data around like what amount of financial support can lead to what kind of outcomes. And it's
Interesting.
when we're integrating Samaritan into professional care navigation or case management, and we're
Hmm.
also coupling it with, Michael, like social support from the community. It's not just money, but there's a relational component as well. You can see a lot of outcomes for a pretty small dollar amount. I mean, with even just $40 or $50 a month, we see most of our members materially improve their access to care and services, to basic needs, in a way that shows up in our data. And we see the best outcomes happen, or the optimal level of outcomes happen, when we can get people about $80 to $100 a month. And 500 a year every 6 months, or $1,000 a year, is just not a lot of money relative to you know the difference in income that people can make when they're housed, or the years that they will live longer, or even, yeah, the healthcare costs that will be prevented um by seeing someone in a more stable situation. $1,000 is nothing.
For those that you mentioned, the community of Samaritans that are investing in sort of seeing other humans flourish in a sense, it would that make, Samaritan sort of a nonprofit, or what other benefit do they get aside from these incredible stories of just people making incredible turnarounds and comebacks?
Yeah, for sure. I mean, I think a lot of people act out of like a missional calling to walk alongside their neighbor in need in a direct, strategic, and effective way. Story of the Good Samaritan, helping not just your neighbor but also your enemy um, take steps forward, if you know that story well. Um, so there's that, and then yeah, we have a platform that makes the giving very effective and trackable, and it's also tax deductible. Samaritan, the technology is owned by regular company, a public benefit corporation, um, and so we have healthcare customers who are using Samaritan to help their hardest to reach, hardest to serve most expensive populations. And then we also have a 501c3 that's separate, that processes all of the donations and all of the volunteering that happens for our members. So it ends up being a tax exempt activity for our Samaritans, but also something that we can commercialize and scale like a regular for-profit
Mm.
in the healthcare industry.
And what do you think have been some of you know, some of the biggest barriers? And you want to help a ton of people, but what's come up? Where have you seen things get stuck? And tell us a little bit about that.
Yeah, I mean, barriers. I think are like, I mean, the reason we got to the healthcare space was because we were trying to iterate and learn from barriers we were facing, trying to sell to cities or to nonprofits themselves. So nonprofits love the use of Samaritan in street outreach and case management, in housing navigation, employment navigation, but
Right.
typically couldn't afford what we needed them to pay to sustain ourselves and to grow our organization. um, and cities, often an inherently political process and a risk
No,
averse process where they're focused on services and housing
right.
a lot more than, let's say, technology or new ways of doing things, to help new ways of helping people. And so not to say that healthcare moves very quickly or is, jumping over themselves to take risks on new opportunities, but we did find that it was maybe a little bit more like like a financially consistent problem that they were facing, and a
Mm.
more repeatable problem across geographies. um and, if we showed them a through line to value, they were willing to try new things. Again, given how much it costs them, and also the fact that the states um, that are providing the Medicaid contracts to these insurance companies like Molina, Elevance, Centene, Aetna, United Healthcare, like these states are saying, hey, you got to figure out how to do better here if you want to work with us again. If you
Right.
want another 3-year contract or 1-year contract or five-year contract for, yeah, I mean, these are big contracts, to serve millions of lives as billions of dollars of revenue for these companies. You need to show how you're helping these individuals, in a new way, in a way that actually is improving the metrics, especially considering how homelessness is growing. And so
Yeah.
these organizations are, in some ways willing to look outside the box and test new things, um, that, maybe aren't providing like housing itself. Like, we're not building any apartments, but we're helping people access the financial and social support that they need, giving them a platform to stand on so they can be more successful in their efforts to find a housing opportunity for them.
Yeah. So I know we're sort of running close to time. I just want to, what's the best way for folks to keep track of your work? And I guess maybe what's one action item that, our community can do to support you and the work that you and your team have been doing?
For sure. Thanks for asking. I think, the maybe a couple possible options for action items. I mean, first, if you want to become a Samaritan, it takes 5 minutes. You do it from your phone, and you can invest in a person, financially or relationally, with just a couple minutes a month or week. And yeah, we're serving people in 4 cities in California. So that's Sacramento, Oakland, LA, San Diego, as well as outside of California, Seattle area, Louisville, Jacksonville, and soon New York City. And so if you have a connection in any of those communities, or you don't, and you still want to help somebody,
Yeah.
download the app or, go to our website, Samaritan.city. And then if, you're listening to this and you're like, man, I serve this population. I want to figure out how to help them more. We're always, considering opportunities to expand Samaritan and serve more people, serve more Samaritan members. And so if you're serving the population, trying to figure out how to engage them, or empower them to to take the steps that they want to take for themselves around their health, around their income, around their housing, feel free to reach out. We're on LinkedIn, social. You can find us, contact us. We are particularly interested in increasing the numbers of members we're serving in the cities that I mentioned.
Mhm.
Yeah, Seattle, SAC, Oakland, LA, San Diego, Louisville, Jacksonville, and New York City. And so if you're serving populations there, we're really excited to talk. And then if you're in a different community, we're probably looking more at 2025 at this point. But yeah, that's what I'd leave you with.
It's a fair ask. Thank you, Jonathan, for even just sharing glimpses of the story. I know that we could probably go a lot more in depth, and we'll have to geek out at another future episode. But yeah, thanks
Sure.
for the work that you're doing, for just kind of making stuff happen, making things accessible. Your story is very compelling. And for those that have tuned in to this conversation, if you found it helpful, my ask is, would you mind liking it, sharing it, commenting on it? What resonated with you, and let's see how we can continue to push this mission forward, and how might we be able to be better Samaritans? So until then, I'm looking forward to our next conversation.
Yeah, perfect. Thanks, Michael.